Good afternoon, everyone, and welcome back, or for those of you who are joining for the first time, welcome to the Partnership Centre for Health System Sustainability Round 2, second session today, which is on integrated care models and better value care. This session will go till 5:20 Eastern Time. So we've got a fantastic panel, like we did with the earlier session before afternoon coffee. And they're going to speak to this issue of integrated care and better value care. I'd like to hand over to a very good friend of the PCHSS, and also really one of the leading lights in the health system, who has championed the cause of healthcare improvement in many guises over a period of many years. So can I invite you, Leanne Wells, CEO of the Consumer Health Forum, to chair this session for us. And welcome back into our lives. And as an investigator in the PCHSS, could you kindly take over these responsibilities?
Thank you very much, Jeffrey. Can everyone hear me okay?
Indeed.
Yes, great. Okay, well, thank you for that very generous introduction. As Jeffrey said, this session will focus and centre around how alternative models of care, such as hospital in the home, virtual care, can contribute to creating more integrated care pathways. The session will include how to identify models of care that should be adopted, but more interestingly, case studies of models that have demonstrated impact on care. Before we go to our speakers, and I'll introduce them consecutively, and the format for this session will be similar to the earlier one. We will have the presentations and then we'll hand back to Jeffrey for a facilitated discussion with all our speakers in a panel format. Before we do that, I just wanted to, and I was asked to provide a brief consumer view or consumer perspective on integrated care. So I've got 3 very quick slides to do that. What I'm sharing on this slide is primarily from a piece of work that we've actually done with the Partnership Centre, Jeffrey and Yvonne and the team. It's findings from the 2018 Australian Healthcare Consumer Sentiment Survey that we did as a collaboration, and that we will be repeating as a major piece of shared research this year. Obviously, some of these comments also reflect sentiment that we established through other Consumer Health Forum consultations and research as well, but that's predominantly sourced from that. So integrated care, a consumer view. Look, overall, consumers have a very positive view about the Australian healthcare system. There's high satisfaction with quality and safety of clinical care, and that's when people actually get that care. They're comfortable with a consistent relationship with a single primary care practice. We know that 3 out of 4 people try and see the same GP. But many believe that fundamental changes are needed to make the system work better. And those changes are not so much around the quality or the quality and safety of care, but the more wicked or more challenging problems that we were touching on earlier around affordability and accessibility. They remain the pain points for consumers. And they're areas of change that primarily speak to where integration can help. And conversely, primarily speak to where we've failed to integrate either services or systems. So it's a pretty relevant issue for today. Digital exclusion is a real thing. By that I mean we're quite concerned at CHF that with the burgeoning direction around digital health and telehealth and virtual care and the enormously exciting horizons that are opening up there, we've got to be mindful, I think, not to widen health inequity because we're leaving many people behind because they don't have the devices, the data, the connectivity to really optimise the extent to which digital health can be a part of their healthcare regime, if you like. A constant plea we hear from consumers all the time is make it easy for me. So it's the issue of the system and services being fragmented and disconnected. That's without doubt the most profound and common experience. Great concern about aged care and aged care health services. Probably not surprising that that's top of mind sentiment at the moment off the back of the Royal Commission, but also the experience we're seeing in aged care in relation to the pandemic. And then there's emergent public health challenges, you know, issues that are often not spoken about, but are increasingly being researched, increasingly being talked about, particularly in terms of the profound impact they can have on healthcare and healthcare pathways, and where systems, particularly health and social care systems, intersect. And I'm talking about issues such as loneliness here. If we can have the next slide, please, Kaylin. So I guess the plea from the consumer sector is, with regard to integrated care, we want practical measures. I think there's high expectations around the current policy environment, both federally and in the context of some of the state directions that we heard about from the earlier presentations this morning. So practical measures, you know, you could talk about what they are and the range and depth that they need to take all day, but practical measures like health literacy programs that are really geared around, you know, the wise consumer, the activated or expert patient, you know, equipping people with information, knowledge, skills to comprehend, act on health information and health advice, to effectively self-manage. All of those things play a critical role in assuring the extent to which people are getting value in their healthcare. Care finders to help navigation and promote access to the right service. Again, the right service being the right service in terms of how a patient would define themselves as getting a valued service. Digital navigators to make the most of digital health horizons. Leading edge models of care, and we're going to hear about some of those in a moment, and financing reforms of the kind we heard about from Tony earlier, that are patient and family centred and that reward multidisciplinary practice and that incentivise integrated enabling systems. Single healthcare destinations, social prescribing to link health and social care. It's another dimension of integrated care. Fixing the chasms between aged and primary care, between hospital and aged care, to smooth service transitions, and taking care to people. I think that's what really matters to people. Healthcare closer to home, healthcare in their neighbourhood, place-based care, those sort of concepts are really where we need to be thinking of when we're thinking about integrated care from a consumer perspective. Next and final slide. So just in summary, I guess some of the takeaways that I'd like to sort of leave at to spearhead this session are, you know, from a consumer perspective, it's imperative on all of us that have some influence in the system, whether we be researchers or advocates, to really keep pressing for policy and programs and services that address access, coordination, affordability. There's such a groundswell, I think, in the merits of a single patient and family-centred healthcare destination, often described as things like healthcare homes or patient-centred medical homes, Aboriginal community-controlled healthcare services as the foundation for integrated multidisciplinary care. As I said, takeout is consumers just really want to see practical measures. Is the opportunity for transformational policy now? I'd like to think it is. I'd like to think that's where the Partnership Centre is really well placed to bring to bear on the current policy agenda lots of learnings and lots of translational opportunities for its research. right from 10-year primary healthcare plans and influencing that through to policy responses to royal commissions into aged care and mental health. Potentially a progressive policy window for us, I think. Integration, best achieved, we believe, regionally and locally, but to do that, it needs an authorising environment and champions. And I think I think it's a really exciting prospect on that regional approach to things that we've got enormous merit, I think, starting to unfold in the way that the co-commissioning and co-production measures that we heard about earlier are happening in New South Wales, bringing together primary care, local hospital networks to co-commission, jointly plan, co-produce, measure together is really progressive and very exciting from a consumer perspective. Consumer preferences and evidence, there always needs to be a balance between the two. They're not mutually exclusive, but they can be different. And I think, look, we've talked about this again, Jeffrey and others influence, stress this all the time, that health system research needs to be translational. It needs to influence and change practices. And a final message from me, I guess, in terms of advocating for integrated care models and better value care, consumers can be as powerful as clinical champions in advocating that agenda. So they're well placed. And again, we heard from WA, for example, how you are drawing in and taking a much more systematic approach to involving consumer voices in the work you're doing as agents of change. So that's a brief, hopefully useful scene-setting set of comments on integrated care from a CHF consumer perspective. So on that note, we will move into our speakers, and I'll introduce them. We've got four presentations, maybe 4 or 5, and they're all very different and incredibly insightful. So over to our first speaker, I'd like to now introduce Professor Rachel Buchbender from Monash University, who will be discussing hospital in the home.
Thank you very much. I'm just sharing my screen. Can you see that? Can you see my screen?
Yes.
Yep, great, thank you. Sorry. To move. So I'm going to talk about a hospital in the home. This was introduced in 1994 to save costs while maintaining high quality patient care. It's generally staffed by a mix of nursing, medical and allied health. And according to a Victorian report, it's consistently affirmed as being safe and